Hello everyone, welcome back to Ifechi Health and Wellness. We are still on diabetes. We cannot talk enough about diabetes because of the global increase in the rate of people being diagnosed and people who are undiagnosed yet. So we are going to be talking a lot on diabetes. This series, we are going to cover various things regarding diabetes. We are just taking it bit by bit so that the videos will be short for people to listen to the end and then benefit from what we are saying. In my other videos, I've already mentioned what diabetes is and the two main types of diabetes. Obviously, there's also gestational diabetes, where people develop diabetes when they are pregnant. Most of the time, once they have the baby, their blood sugar regulates. However, if they do not change their lifestyle in future, they may eventually develop diabetes. So if you have ever been diagnosed with gestational diabetes when you are pregnant, as soon as you deliver, yes, it goes away, but please make sure you look after yourself long term. Watch what you eat. Just manage yourself as if you have diabetes, because if you don't, it will eventually come back. So this is something I needed to chip in before I start talking about the symptoms of diabetes as described under the 3 P's. The 3 P's that you have to look out for before you think, what's going on? And then obviously the best way to be diagnosed is to go and get yourself investigated. But the 3 P's I want us to look at today are polyuria, polydipsia, and polyphagia. Individuals with high risk for developing diabetes should be alert to these symptoms and seek medical attention if they notice any of the above symptoms. So what is actually polydipsia? Polydipsia is an increase in thirst. Polyuria is frequent micturition, that is urination. That's what polyuria is, frequent urination. And polyphagia is rise in your appetite, increased appetite. So let us look at them one by one, because these 3 P's are actually very, very important. Let's take them one by one. Polydipsia is the word used to describe excess thirst. If you are experiencing polydipsia, you may feel thirsty all of the time or have persistent dry mouth. In people with diabetes, polydipsia is caused by increased blood glucose levels. When blood glucose levels get high, your kidneys produce more urine in an effort to remove the extra glucose from your body. Meanwhile, because your body is losing fluids, your brain tells you to drink more in order to replace them. This leads to the feeling of intense thirst associated with diabetes. Persistent feelings of thirst can also be caused by other things, so it's always good to check yourself out before you decide whether actually diabetes is the cause of your own excess thirst. So the next one, 2, is polyuria. This is the term used to describe when you are passing more urine than normal. Most people produce about 1 to 2 liters of urine per day. That is 1 liter equals to 4 cups. People with polyuria produce more than 3 liters of urine in a day. When blood glucose levels are too high, your body will try to remove some of the excess glucose via urination. This also leads to your kidneys filtering out more water, which leads to an increased need to urinate. Passing abnormal amounts of urine can also be associated with other things besides diabetes, such as pregnancy, kidney disease, high calcium level, mental health issues, and stuff like that. So it's always good to check things out. Don't just assume that it may be this or that. Check it out. Number 3P is polyphagia. Polyphagia describes excessive hunger. That's number 3P, polyphagia. Excessive hunger. Although we may all feel an increase in appetite in certain situations, such as after exercise or if we haven't eaten in a while, sometimes it can be a sign of an underlying condition. In people with diabetes, glucose can't enter cells to be used for energy. This can be due to either low insulin levels or insulin resistance. Because your body can't convert this glucose to energy, you will begin to feel very hungry. The hunger associated with polyphagia doesn't go away after consuming food. In fact, in people with unmanaged diabetes, eating more will just contribute to already high blood glucose. Like polydipsia and polyuria, other things can cause polyphagia as well. Some examples of this one, other things are overactive thyroid or hyperthyroidism, PMS, which is premenstrual syndrome, stress, or taking some medications such as corticosteroids or steroids. Yeah, they can cause excess weight as well. So don't just assume that you are feeling very hungry is because you have diabetes. Go and check it out. It's very, very important to check things out. Once these you will notice these 3 P's, or it may even be one of the P's, or 3, or 2 of them, or even the 3 that you're noticing. Just go and check it out. There's no harm in checking things out. Don't just say, oh, it is this or is that. Since the 3 P's are good indicators that your blood glucose levels may be higher than normal, your doctor can use them to help diagnose diabetes. However, other symptoms can also occur alongside these 3 P's, and these include feeling tired or fatigued, blurry vision, unexplained weight loss, sensations of tingling or numbness in the hands and feet, slow healing of cuts and bruises, recurring infections. I've said this before. So these are the things, the other symptoms that you may also experience. But go and have your blood test. HbA1c will tell your doctor whether you are actually diabetic or not. There are other, you can do fasting blood glucose as well. There are other things they can do before diabetes is confirmed. And once it's confirmed, you don't have to wait. You have to start immediately to do things that will help you. If you're overweight, reduce weight. Even if you're not overweight, increase your exercise. Look at what you're eating. Cut out carbohydrates and stuff like that. It does sometimes diabetes, even type 2, is not only for people who are very overweight. Some people who have normal weight, and because of their predisposing factors, they can also develop diabetes. So it's very important to please watch out for these signs. And if you are unsure, the best thing is to check it out. Do the test, please. And because once diabetes is caught on time and you start doing things to reverse it, then it's easier to manage. It's not going to be cured. It can be reversed. It can be managed, because if you go and start doing what you are doing before, it will definitely go back to being very high again. So I'm going to stop this one here. Next session, we're going to talk more different things about diabetes. Thank you so much for listening. Goodbye and God bless.